this series we have completed the maximum part, and also we have seen the cranial nerves, which are 12 in number, which are paired, and we have seen the naming of all the cranial nerves, and here we are seeing the some of these nerves are sensory, motor and mixed. Sensory means those nerves which will take the impulses from organs to the brain, and some impulses which brain sends to the organs, and some nerves are like that which will perform both the actions in this. So we have learned till now olfactory is sensory, optic is sensory, oculomotor is motor, trochlear is motor, trigeminal is mixed, abducens is mixed, facial is mixed, vestibulocochlear is sensory, glossopharyngeal is mixed, vagus nerve is mixed, spinal accessory nerve is motor, hypoglossal is motor. So you can easily remember like this as I learn: sa, sa, ma, mi, ma, mi, sa. This is mnemonics. It's easy for me to learn like this. You can also make your own formulas to learn. Sa, sa, ma, mi, sa, mi, ma. It's like a rhyme. It's like a rhyme as I learn. Sa, like rhythm. Sa, ma, mi, ma, miss. It's like miss, mi, ma. It's like song I have made. So you can remember like this. You can also remember like OOTTAFVGVSH. Okay, OOT. So you can also remember mnemonics like this: O T T A F V G V S H. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Now these are 12 cranial nerves. O means O3, T2, AF, GV, VGV, SH. This is a mnemonic. And second mnemonic is to remember which nerve is which. Sa, ma, sa, ma, mi, ma, mi, sa, mi, ma. See, it's working. So easily we can remember like this. Okay. Now let's see the structure of these cranial nerves, how it arises from brain. So this is the structure of the brain. This is the inferior view. When we watch the brain inferiorly, this type of structure will appear. This is the frontal lobe, this is the cerebral. Frontal lobe, temporal lobe, parietal and occipital lobe. But since we are taking this picture from downwards, we are getting this cerebellum. Okay. Now these are the nerves, cranial nerves, which arises from the brain. So first of all, suppose we are going in market and we are suddenly getting the smell, delicious smell. Then our sense organs, our sensories which are present in the nasal nostrils, that will carry the sense that something delicious is coming, and we are scenting, and that message goes to brain, some delicious food is surrounding. So this is carried by olfactory nerve, which is cranial nerve 1. It is carrying the sense of smell. So this is sensory nerve. This is cranial nerve 1. Now we are getting the smell that some food is around here. Then we started watching it, searching it, where it's coming from. Then suddenly we notice that from that corner food stalls are there and fast food is there. So we have visualized that thing. So that will carried by optic. optic nerve. This is our optic nerve. And which type of impulse it's carrying? It's carrying the sensory. It's taking the picture of food to the brain. It's sending the pictures through messages. So this is our cranial nerve 2. Now this is our cranial nerve 3. These all will be in pairs. So this is our third cranial nerve. This is oculomotor. Now see, you're getting the smell, you're getting the visualization that from this corner food is here, so we are getting smell. Now our eyes start searching which is our favorite food. We started searching. Our eyeball rotates, so the rotation of eyeball is due to oculomotor. So which type of sense is this? These nerves sends message to the brain that such type of things is surrounding. So eye starts, the brain sends the message for to search that food. Now eyeball started rotating in all the directions. So which type of impulse is this? This is motor. So oculomotor nerve is motor type, and this is cranial nerve 3. Sorry. Oculomotor nerves helps the eye balls to move in all directions. Okay. This is our fourth cranial nerve. This is our trochlear nerve. Again, what happens? We started looking for our favorite food. Which type of foods? Different types of foods are there. We started searching for example, momos or cheeseburgers, or for example, pav bhajis. Then we started looking down. So the downward movement of the eyeball is due to trochlear nerve. Superior oblique muscle is active here. Superior oblique muscle helps in movement of eyeball to downward direction. So we are watching that food. It is also motor in nature, and this is our cranial nerve 4. Now you will easily know which type of nerve it is by the trying. See? Name of this nerve is trigeminal nerve. Trigeminal nerve. This is our cranial nerve 5th. Which type nerve it is? So 3 things must be there. What are those? Trigeminal nerve. Trigeminal nerve has ophthalmic nerve, maxillary nerve, and mandibular nerve. So 3 types of nerve is involved. So that's why it is called trigeminal nerve. Now ophthalmic nerve. Ophthalmic nerve is mainly carries the senses around the orbital area, ethmoidal bone, sinuses, like lacrimal glands. So these are mainly sensory nerves. Means they are taking the senses from this area to brain. Ophthalmic nerve. which is which carries the impulses from the lacrimal glands, or sinuses, ethmoidal bone, and the orbital area. So they are sensory type. Maxillary nerve. Maxilla means the upper jaw. So upper jaw, all the senses which are we getting on the faces is by this maxillary nerve. So all the sense carried by maxillary nerve. Now, if somebody will ask which jaw is movable, upper jaw or lower jaw? Upper jaw is maxillary, lower jaw is mandibular. So basically our lower jaw is movable. So it is responsible for the muscles to move in the lower jaw, in the mouth. Whatever we eat, whatever we chew is because of the mandibular muscles, and it is supplied by mandibular nerve. So there is a muscle of mastication, chewing. The teeth are present on both the jaws, and whenever this lower mandible this moves, the mouth it works. We chew the food. So which type of nerve it is? It is motor. All type of the senses goes to brain, and brain is sending the message through this mandibular nerve. So this is motor type of nerve. Now talking about the trigeminal, which is formed by three types of nerves. So trigeminal is basically combination of sensory and motor, that is mixed. Clear? Now fifth nerve. Sixth nerve. This is also in pair. This is our smallest nerve. The smallest nerve in our body in cranial nerves is abducens nerve, which is cranial nerve 6. Remember, it is the smallest nerve among the cranial nerves. This is also in pair. And which type of nerve it is? First of all, abducens is responsible for lateral movement of the eyeball, means sideways movement of the eyeballs. Now you are gone in market, you are searching your favorite food, you are moving your eyeballs in every direction, downward direction. When you look, it is because of the trochlear nerve, and when you look sideways, it is due to abducens nerve. So abducens nerve is also our motor nerve. Now 7th is our facial nerve. This is our facial nerve. Now again facial nerve. Anterior 2/3 of the tongue is supplied by this facial nerve. Any sense we getting on our face is because of facial nerve. And facial nerve is also the combination of different nerves on our faces. Like facial nerve supplies the anterior 2/3 of the tongue and the muscles for the expression of face. So it is responsible for two types of senses. Sense which we are getting on the face, suppose cotton is touched on our face, we are getting the impulse that suddenly something is coming on our face. So this is due to the sensory nerve, which taking the impulses from face to the brain. Now brain is also sending the impulses through facial nerves to make expressions. So this is, here we see there is sensory plus there is motor, so this is mixed. Facial nerve is our mixed type, and this is cranial nerve 7.